today by Dr. Arvin Bagherpour. He is interventional radiology, has joined us in the last few months, doing a great job providing an advanced service here at Oak Bend Medical Center. And we're going to talk about DVTs.
Oh, wow. Okay.
What does DVT stand for, and in layman's terms, please?
DVT stands for deep venous thrombosis, but essentially it's a clot in your vein, not your artery.
Okay. It's a clot in the vein. Okay. Is it dangerous?
It's very dangerous.
Why? A clot. I mean, I get clots on my hands, cuts, what have you. What's the big deal?
Well, they generally start in your legs and they work their way up towards your lungs.
That's a bad thing.
Just like a heart attack, your lung can have a lung attack.
Okay. All right. That would make it difficult to breathe. What would be the symptoms that I might experience?
Shortness of breath.
Okay.
What we call pleuritic chest pain when you're breathing in and out. Those are classic findings when you have the sequelae or the consequences of a DVT getting really bad. But at the initial stages, what we see is swelling or redness or what we call edema, like getting big or swelling more in the legs. And it could start as low as your ankles, and it could work its way up towards your knee. And then when it gets really bad, above your knee and going in towards your abdomen and then towards your lungs.
That's like what happened to me.
Yeah.
Okay.
Unfortunately.
Right. Yeah.
But fortunately for you.
Fortunately, hey, I'm here.
Yeah.
Okay. That's a good thing. All right. So how does it, what causes it?
There's three things that generally cause it. One is like not moving around and stasis. So one of the classic things is you've been on a long drive or been sitting at your desk or got on an airplane and you got up and like over the next couple of days you develop a swelling in the leg. In fact, this is something that hits really close to me at home, and one of the reasons why I became an interventional radiologist. My aunt at 52 got off an airplane, and then 2 days later she died from a DVT and had a pulmonary embolism.
Okay,
and they found her.
How any flight, like an hour-long flight?
Well, it really depends on your risk factors, but generally it's longer flights or longer car drives. That's why we do recommend every hour that you get up and walk around and do things, or at least move your ankles and things like that. And particularly in the hospital, we do a lot of things to prevent you from having a DVT.
Right. So, let's define. So I had to talk to a lot of doctors associated with my DVT, and I got varying different views of the length of flight, but all of them thought that, for example, in my case, I traveled from New York to Houston. They didn't think that was a long enough flight to trigger a DVT.
Yeah, well, that's why we talk about there's a few other compounding or initial variables that can cause that. And in medical school, we learn a thing that's called Virchow's triad. And it's a big word, but really it is like if you have any inflammatory state, inflammation going on, that's a big thing right now. Everybody's talking about inflammation, but we're talking about really like if you have, let's say, trauma that causes inflammation, or if you have an underlying cancer or other like blood issues, genetic issues or acquired issues that cause this inflammation, and that could happen. And then stasis, meaning not moving around.
Okay.
And then there's very rare, but there's a few other things that we don't need to go into today. But basically, anything that stops the movement of blood, some way or the other, can cause a DVT.
And of course, surgery can cause a DVT.
That's exactly right, because surgery is a time where you're not moving around a lot.
Okay.
And as well as it's pro-inflammatory, meaning we're causing more inflammation.
Well, you're also cutting blood vessels, so blood is going to clot. And if it doesn't clear out of wherever, like a knee procedure, something like that, that is a common cause of
That's very true, yeah.
Common cause of a DVT. How about trauma to the leg? I mean, like, could I, in working in my garage, have bumped into something and caused some sort of lower leg trauma that caused a DVT?
Yeah, I mean, if you bump your leg hard enough and now you're not moving around, it's hurting, within the day or so, it could cause that.
Okay. So that was the other question I had, is how long does it take for a DVT to develop?
Our body actually makes clots all day, like you mentioned earlier. All day, we cut ourselves, we have micro trauma, and it's stopping it. But that when that is unable and it propagates, let's say there's no exact timeline. That's why we always recommend, like, if you have pain or swelling that's not normal, or if your legs look different, asymmetric, one is bigger than the other all of a sudden, then you need to start thinking about it. And in fact, what I tell my patients is, don't try to be the doctor. If you have a problem, come see somebody and we'll help you, because it's actually pretty simple for us to diagnose it. It's non-invasive, and you may be getting here, but we use an ultrasound.
Okay.
And it's not radiation. And we basically, if this was your leg or your arm, we put a little probe on there and we look and we track it. And if it doesn't look normal at some spot, then we get worried it's a clot and we work it up.
So how quickly should I, in my case, I felt like my leg was hurting Saturday morning, and when I got dressed to go out that evening, I noticed that it had gotten swollen. Would the proper course of action have been for me to go in to an emergency department? Obviously, my doctor doesn't have hours on the weekends. Well, not obviously, my doctor doesn't.
So the most appropriate course of action is to go to the emergency department or an urgent care.
Okay.
And sometimes
urgent care would have an ultrasound to diagnose the condition.
Almost every outpatient acute care place has an ultrasound.
Okay. All right.
And even if you're in your OBGYN's office, to have an ultrasound. But at these urgent cares and the ERs, they're specially trained.
Okay, well, let's differentiate, because we've had a Cup of Joe episode on urgent care versus ER. So an urgent care, in my mind, is a physician's office that has extended hours.
Exactly.
Not all physicians, however, have ultrasound machines. So if I have a DVT, it sounds to me like I should be going to an ER, freestanding or hospital, or one of the two.
I agree with you. More even beyond just diagnosing it, but an urgent care can't treat you.
Right.
And the ER here at Oak Bend and its affiliated places can diagnose you and treat you, because one of the things that's really important is the time frame that you get treated.
Okay. So we're going to go upstairs and we're going to look at what you guys use to treat patients with certain types of DVTs, and you'll help us understand what DVTs are appropriate. But this has been really instructive, and I look forward to going upstairs and checking out your equipment. All right, we're here in Oak Bend's Cath Lab at our Jackson Street campus. Dr. Bagherpour is going to share with us, one, what we use to diagnose the DVT, and then what we use to treat the DVT. So please proceed.
Thank you. So what we talked about earlier was very simple, a non-invasive test that can diagnose you if you have a deep venous thrombosis, a DVT. Okay. So essentially we use this ultrasound, and I think it's even on this one, and we just put some gel on you, very simply, and we image it. And it comes up, actually right there, you can see my artery. And right next to it, you can see my vein. You won't be able to catch it on that camera probably, but it's very simple. It looks like a
lot of gray stuff to me, but to you it means something.
Yeah, and then I can follow it the whole way. And within about 20 minutes, I can tell you if you have a DVT or if you don't, and you're safe to go home and it's something else.
Okay. All right, cool. So a pretty simple procedure, pretty quick.
Very simple.
No pain. Okay, cool. So now that you've determined that I do have a DVT, so you're going to use this device to address it? Is that the plan?
This is the same machine here that many people know about when they have to have a heart exam. The heart gets looked at, or they have to get a stent.
Okay.
But this machine does a lot of things. It allows us to look inside of a human's body.
Okay.
And to then actually treat it.
Okay.
So it's an X-ray. X-ray comes out of here.
Okay.
There's nothing going inside your body. Okay. And then through this X-ray, we put the patient right here. And you'll lie down, and we know where the DVT is. Okay. If it's here, and we'll access you through your foot. Like there's a little tiny needle. This is an open surgery.
Okay.
This is the only thing you feel is like getting a shot.
Right.
At the beginning.
So they gave me some light sedative to just make me comfortable.
Exactly. We'll give you some sedation.
I was awake the whole time.
Yeah, you don't have to be intubated. You don't have to be like as if you're in a surgery being open, because nothing in this that we do to cure you is to open you. Okay. It's really to open up that vein without damaging it.
So if it's in the lower leg, you're going to go through the foot.
Yes.
In my case, they went through the back of the knee.
Yeah, right here.
And they went up. They didn't go down because they said the veins down below were too small to go down.
That's right.
And they said that the body will just absorb that clot over the course of time.
With the anticoagulants that we give you, the blood thinners.
Eliquis is what they put me on.
Yeah, exactly right. So from back here is when we have the big DVTs. Yep. And we really want to treat them. Okay. That's, it grows. This thing could get done pretty quickly. And it goes up, and it can get worse pretty quickly. That's why you got to come into the ER fast. And we
Okay.
can treat it where you don't have any problems with it afterwards.
So you have no lingering effects. If you don't get it treated, however, you could have
Big
permanent
problems.
lingering. They told me it's something like you could have dead leg. So what is dead leg?
Basically, your leg will swell up so much and the veins get damaged, your leg's not going to work. And in fact, it could get so bad to where just like people get gangrene, you're not getting blood flow back up. You might lose your leg.
Ooh, all right. That's bad. That's very bad.
Yeah.
Okay. All right. So if I fail to ask anything about the treatment, it's called a thrombectomy. Isn't it?
Thrombectomy, yes.
Okay. So we figured out how to diagnose. We figured out how to treat. It's not too bad. Do I get to go home afterwards?
Basically, in a day, you get to go home or the same day.
Because they're going to watch me overnight, make sure no PEs or pulmonary embolisms.
And I think something that's important to mention is not everybody needs an actual operation or surgery.
Okay.
Some people, they only have the clot below their legs.
Right. So
and we can treat you with the medicine in that situation.
Gotcha.
And some people may not be a candidate for surgery,
Okay.
but we can still give you medicine to prevent all the bad things that happen.
Got it. All right. Well, thank you so much.
You're
This
welcome.
is fascinating. Love this. Love going and understanding more about our machinery. So thank you all for joining us for Cup of Joe, and I look forward to seeing you on another episode soon.